Hi, this is Dr. Ady Kahana from the American Hip Institute, presenting our research on primary labral reconstruction with minimum 10-year follow-up. Our disclosures can be found online. It's important to remember that the cornerstone of FAI treatment is the restoration of the suction seal provided by the labrum. When primary repair can't be performed, the next best option is labral reconstruction. In cases where the labrum is calcified, they have segmental or circumferential defects, or tissue quality is not there. And while short midterm studies have proven that it is an adequate procedure, there's paucity in the literature providing evidence for long-term outcomes. So the purpose of the study was to present minimum 10-year of patient-reported outcomes and compare it to a benchmark control group. Our inclusion criteria was primary labral reconstruction with a complete 10-year follow-up with our PROs, and also endpoints defined as revision arthroscopy and conversion to THA. Our exclusion criteria were any revision treatments, any prior pathology like dysplasia, Berthes, Skiffy, and fractures. We excluded work comp patients as well as any signs of OA with a tonus grade higher than 1. At the end, our patient selection, we managed to match 22 hips with a primary labral reconstruction to 66 hips with primary repair. This was done by a propensity score match, and we matched based on age at the time of surgery, sex, BMI at the time of surgery, and outer bridge classification of both femoral and acetabular components viewed during surgery. There were no clinical differences in our selected patients, as well as no differences in our radiographic data, pre-op and post-op as well. Our results show a significant improvement for both groups in all PROs, with no significant difference in the magnitude of improvement or at the post-op scores they finally achieved. We ran durability tests, and we saw that patients continued to improve throughout the last decade, having similar results at 2, 5, and 10 years. When looking at clinically significant thresholds, both groups managed to attain the thresholds at a similar rate, with the exception of the non-orthotic hip score, SCB, which was in favor of the repair group. And as you can see, there's a trend for better outcomes with the primary repair, but it was not significant except for NIHS. When it came to survivorship, overall the survivorship was similar among both groups, with 90% of both cases lasting over 10 years. So in conclusion, we can achieve favorable outcomes after primary reconstruction with minimum 10-year follow-up. When compared to the benchmark control group, both groups undergo similar magnitudes of improvement in all PROs, with comparable rates of revision arthroscopy and conversion to THA. Thank you very much.